Hi, my name's John. I'm the head therapist here at John W Sports Injury. And here at John W Sports Injury, we're incredibly passionate about helping parents and their child and loved ones overcome the frustrating condition that is Osgood Schlatter disease. Now, we personally believe that Osgood Schlatter disease is one of the most miscommunicated, and people like you being ill-informed about the true condition that it is. So what I want to do in this short video is cover some of the frequently asked questions that we get around Osgood Schlatter disease, so you can truly understand what the condition is. So in this video, we're going to talk about what Osgood Schlatter disease actually is. We're going to talk about who it might typically affect. We're going to talk about the two statements that I absolutely hate that I commonly hear being attributed to this condition. We're going to talk about how you can truly overcome Osgood Schlatter disease. And finally, we're going to talk about how long it takes to recover from Osgood Schlatter disease. So firstly, what is Osgood Schlatter disease? Well, put in its most simplest form, Osgood Schlatter disease is a growth-related condition that affects people with pain just below the kneecap. Now, why does this happen? Well, in the adolescent athlete, so in the growing child, the area below the kneecap, this bony bit that you can see here, this bony protuberance, is what we call the tibial tuberosity. Now, in the adult, this has turned to bone because their growth has finished. But this is, in the growing athlete, what we term a growth plate, and it's not bone. It's a cartilage structure. And because that allows the bone to actually grow. When it finishes its growth, it ossifies and turns to bone. But why is this a problem in a growing athlete or child? Because our quadricep muscles or our thigh muscles, they attach directly onto this bony part. So again, what we're talking about here is a part that isn't bone in the athlete. So as they're using these muscles, they can pull away at this point, and that can create irritation or pain that increasingly gets worse the more sports and exercise that they do. So, who do we see who typically suffers from Osgood Schlatter disease? Well, as I mentioned, it's a growth-related condition. So we typically are working with people between the ages of about 10 to 16. In boys, it tends to peak at around 14, so 13 to 15. In girls, slightly younger, so maybe 12 to 14. But it's not exclusive to this. It can really affect people anywhere from even younger than 10 to actually older than 16. But they're some of the key people we see. And there's a few key criterias that may well affect Osgood Schlatter disease. So firstly, people who play a lot of sport, and in particular jumping or running sports, may be more susceptible to the condition because they're using those muscles more and in a more demanding fashion onto that knee. Also, people who may be either at the early onset or finished a growth spurt, again, may be more susceptible to the condition because the growth plate is active and as a result more susceptible to the pain. However, I do want to reiterate that if you do not fall in these criteria, it doesn't mean that you can't suffer with Osgood Schlatter disease. What we know about Osgood Schlatter disease is that it's an overuse condition. So the more we use those muscles that have some dysfunction, the more likely the pain is going to increase. So what we would typically see in a child is them suffering pain below the kneecap, and it's pain that's not present at the start of the sport, but will increase as the sport continues. So, what are the two statements that I hate around Osgood Schlatter disease? Typically, people will come in and they will say to me, I don't really understand what it is, but I've been told that I should either just make my child play through it because they'll get there in the end and the pain will go away, or I should just take them away from the sport and exercise they love until the pain goes away. Now, I disagree with both of these statements, and I feel that really they give a disservice to your child and loved one. I believe that Osgood Schlatter disease is a condition in its own right, and it's an injury that deserves an individual personalised rehabilitation program. So, how do we overcome Osgood Schlatter disease? Well, in order to truly overcome Osgood Schlatter disease, we firstly need to find out the cause. Now, I describe overcoming Osgood Schlatter disease as like a scenario of trying to cure a child being bullied in the playground. Now, if we imagine that the child being bullied is the knee, the area below the kneecap, and we take the bully to be the muscles that are above the knee pulling down on that knee. Now, I often ask the child who I'm treating, if we took the child away from the playground, what would happen? And things would settle down. So if we imagine taking that child and their knee out of the sport and exercise they love, things would settle down. But as soon as we reintroduce the child into the playground, what's going to happen? The bullies are going to return and the problem's going to come back. And that's exactly what happens with Osgood Schlatters disease, by just simply taking somebody away and resting them for a period of time. It may settle down, but as soon as they come back in, the problems are going to return. So what we actually need to do to resolve the situation of the bully and the child being bullied is we need to correct the bullies. And that's exactly what we need to do if we want to correct Osgood Schlatter disease. So what we need to do is we need to find out the true cause. What is causing your child or loved one's pain? What is causing this excessive force to be applied to the knee, so that we can correct it and they can truly return to the sport and exercise they love. How long will it take to overcome Osgood Schlatter disease? Well, the truth is that this will vary per child. And it's a slightly different condition in that we're dealing with nature here. If somebody sprains an ankle, we might be able to estimate how quickly they can come back. But the truth is that we have many children who go through our program who resolve their issues in as little as a week, once they understand the habits that they need to adopt in order to correct the dysfunction that's happening. But for some children, it takes a little bit longer, because we are dealing with growth and we are dealing with nature. So there is no real answer to that. But what we do know is that the quicker that we address these things, the quicker we understand the true cause, and the quicker that we put some corrective treatment and rehabilitation in place, the quicker they will return to the sport and exercise they love. So I hope that that's been helpful as a quick summary. It really is a detailed condition, and what I've done is I've put together a more detailed webinar that I can send across to you. So if that's of interest, it's about 15 minutes in length, and it goes into some of the questions and points that I've talked about in some more detail. Pop your details in, you'll see the link below, and we will send that to you. Or if you'd like to work with my team in order to help your child or loved one overcome Osgood Schlatter disease, we can do that either virtually or face-to-face in one of our clinics. Then again, you'll see the information below, and we can happily get that arranged for you. And ultimately, what we want to do is be able to make you truly understand what Osgood Schlatter disease, why your child or loved one is suffering with Osgood Schlatter disease, and what you need to do in order to get them back to the sport and exercise they love.